So I guess what I would say about my path at Connections Counseling is, so when I started, I had the basics from my master's degree in counseling, of course, how to build rapport and kind of do basic things. But then I was introduced through you to the developmental approach. So going back, looking at a person's history, their family of origin, the relationships there, and the dynamics there, and learning to tie those to the present. And that has informed a lot of my direction since then, as far as theory goes. So I kind of looked at attachment and looked at object relations. And of course, it also comes up in our couples counseling and the approaches to couples counseling, and seeing how the couple can sometimes recreate old dynamics from the families of origin. So I've done a lot of research and learning about theory through that lens because of my introduction to it at Connections. And then the other big piece is because of the EMDR that you do and offer through Connections Counseling, I was introduced to working with the nervous system and with visualization, which to me is all in the broader category of mindfulness. And that's been really useful for me because I have a background in training, strength and conditioning, and athletics, and also now in particular high performance. And so I was once, I guess 4 or 5 years ago now, I was at a conference where there was someone talking about high performance and athletics. And that person said that if you have an athlete and they want to do high performance and you're trying to work with them on, say, visualization or flow states, something like that, and there are other underlying mental health things, maybe anxiety or depression or ADHD or something, then that can interfere. And so that person might need to have some counseling or therapy or something to work on that, so they're then ready to do what's coming from the high performance. And so I was interested in that. And through my other work, I've been able to then take what I've learned on visualization, tapping, and nervous system regulation, and also trauma work, and translate that into helping athletes, if they want to go the high performance route, be prepared for that. So that's been like the major threads that I've followed, and I was introduced to them here, at Connections Counseling.
Well, so I'm going to ask you a question about that. Do you find that the people that you're working with who are interested in high performance have benefited from counseling if you offer that to them?
Definitely. So actually, one of the first times that I started to work with a professional performing artist who wanted to do some visualization work, largely to overcome an injury, I was doing a body scan with this person, getting them to, learn to scan the body, be in touch. What are you really sensing? And so she's going through this, and she says, "Yeah, I feel very connected to my physical state right now." And then she says, "And that's making me feel really panicky." And I could see her eyes just kind of like, and I could see her falling into this like panic place. And I thought to myself, oh boy, if we keep doing this, she's going to have an all out panic attack right here. And so I was able to recognize that, which I don't think I would have been able to do if I didn't have the background in the counseling. And then B, I also was able to just sort of calmly be like, okay, so, what do you do when this happens for you? And she said, well, I just try to focus on my breaths. I said, great, we're going to do that. Put her in a plank, said, just do 10 breaths in this plank position, and then we could move on. And then, so I was able to defuse it. That was good. And then And then later we had the conversation. I said to her, you may benefit from doing some therapy. And actually, the therapy I was thinking of was very specific because of Connections. It was the AMST affect management
Skills training.
skills training. Thank you. Yes, I just remembered as AMST affect management skills training from Omaha, which is actually a set of visualizations, right? So tapping and visualization work to build up skills to manage any number of things. And I said, so I was able to say to her, like, we could go through that for 8 weeks or something, or 10 weeks, and get you that skill set. And then once you have that, then you'll be prepared to go back into this stuff we're trying to do in the performance realm. And that worked really well. She did that. We did, a number of sessions working on that skill set and working a little bit with whatever else came up along the way. And then when we were going back to doing physical training, she was in a place where she could then implement that stuff. So yeah, it worked really well. And since then, I've had other clients where it's the same thing. And a lot of times now, right from the start, we'll basically do therapy sessions and then do the physical training. So it's been really good, and it's broadened the services that I can offer, in the strength and conditioning world.
Okay. Well, I think it'd be good if I could know if you have a website that kind of describes how people can get to you. So that would be what?
Yeah. So I guess there's two. So one is FlySpace. And so the website there is www.flyspace, FLYSPACE.com. So flyspacenyc.com. That's an integrated facility, physical therapy and high performance and athletics. Doesn't have to be high performance, but athletics, strength and conditioning, all that kind of stuff. We work with a lot of performing artists. We work with some athletes, some Olympians, and we do, a whole variety of offerings. And then I also have my own small business, and that's called Utmost, and the website there is www.reach, REACH, Utmost, UTMOST.com. And that one I really talk a lot about integrating therapy as part of your health and wellness journey. So that one's a little bit less kind of like athletes and high performance focused and more just overall wellness for the average person. But they both of those places offer it all across the spectrum.
Okay. That sounds wonderful. Thank you for kind of telling me how your business and your interests have expanded, because I haven't heard about that before.
Yeah.
You work with your wife? She's a physical therapist?
Yeah. So the space we have in Manhattan is, we have a roughly 2,000 square foot space. The front part of the space we use for strength training, and then the back part of the space is a physical therapy office. And so it's called FlySpace. And so, the physical therapy, they see about 80% performing artists, but anyone can come. And then in the front, like I said, there's a lot of personal training for just your average person, but also then strength training. Any of the athletes or performing artists that get seen in physical therapy, we sometimes, can bridge them once they've been through their physical therapy and they're ready to get back. They need a little extra boost, a little more strength, a little more this or that. We can kind of bridge them through that by doing strength training. Sometimes, actually, something that comes up a lot is an injury. If someone is struggling to get past an injury, maybe they've got a really Injuries can be pretty traumatic for athletes, of course, right? Because they're looking at maybe losing their careers. It can be really stressful, and so sometimes anxiety and depression gets tied up in there. And so, on occasion, to help them recover more effectively, it's useful for me to work with them a little bit, work through some of that anxiety, depression, just like I was saying before, use some skills, learn some skills to manage those things, then be able to more effectively work with their own bodies. So there's some cross work there as well.
Okay.
Yeah.
Well, thank you very much for kind of allowing, me to know more about and us, because I'll put this on
Yeah.
YouTube, I think, on the Connections Counseling place,
Yeah.
um, about what you're doing and how you're integrating therapy with physical training or
Yeah.
physical healing. Yeah. Okay. All right.
Cool.
Thank you.
Mm-hmm.